Order. Before I start, can I remind honourable members of the new rules in Westminster Hall? Honourable members should be getting used to them now, but some people won't have been in a Westminster Hall debate. Can I ask members to sanitise their microphones using the cleaning materials provided before they use them and dispose of them as they leave the room? Members are also expected to honour the one-way system, which means going that way round, going in that entrance and leaving by the other entrance. Members can only intervene if they're on the call list. If they're on the call list, you are expected to be here at the start of the debate. But unlike prior to COVID, it is quite permissible to leave after having spoken. Right, order. And before I call the honourable member for Hartlepool, I need to advise honourable members that I have been informed that there are active health and safety executive criminal legal proceedings against Essex Partnership University NHS Foundation Trust relating to deaths in mental health care facilities from October 2004 to April 2015. I have further been informed that the Trust has pleaded guilty in those proceedings to failures of care relating to the deaths of 11 patients. Active proceedings are sub judice until sentencing or discontinuance under the House's resolution, and therefore members should be mindful of matters still before the courts, in particular the judgment and sentencing in this case. I'd like Mike Hill to move the motion.
Thank you, Mr Stringer, and it's an honour to serve under your chairmanship. I too received the advice not so long ago and sought advice on behalf of the petitioner in regard to anything that I have to say, and I will navigate through the statement, bearing in mind that legal statement, Mr Stringer, but I apologise in advance if I do stray into territory, simply because to do justice by this petition, I have in the majority chosen to reflect the words of the petitioner. I think it's only right and just. Over 100,000 people have signed this particular petition. It is a very personal case, but it's also a personal case for other families whose relatives have died in such horrendous circumstances. So, Mr Stringer, I beg to move that this House considers e-petition number 255823 relating to deaths in mental health care. And I start by saying the petition raised 105,580 UK signatories in support, despite being curtailed by government closure last November due to COVID of Westminster Hall. I shall start by reading the petition text so as to put it on the record and inform honourable members fully. The petitioner, Melanie Leahy, who I've spoken to on several occasions and to whom I pay tribute for starting this petition, she wrote in the petition, "I request a full statutory public inquiry into the death of my son, Matthew Leahy, 20 years old." Now, Matthew Leahy was taken to a so-called place of safety and died in there 7 days later. 24 others died by the same means, dating back to the year 2000. An indicator that little was done to address the growing problems. Something went terribly wrong with the NHS mental health services provided to Matthew. There really is no way that public concern can be allayed short of an inquiry. All investigations to date, including police and inquest proceedings, have been based on a trust serious incident investigation. A 4.5-year Parliamentary Health Service Ombudsman report has now concluded that this investigation was not adequate and lacks credibility. There has been an inadequacy of investigation, a human rights violation, new evidence has been uncovered, and it is requested that a statutory inquiry that compels witnesses to give evidence on oath is now started. Matthew is not alone. Many others have died in the same institution whilst in the care of the NHS. The petition ends with a link to a press report dated November 2018, detailing how a 2-year police investigation sparked by Matthew's death 6 years earlier into the corporate manslaughter of 24 further patients was dropped, leaving families without any accountability or recourse for their loved ones' deaths. I wish to speak on this petition and open the debate on behalf of the Petitions Committee, and I will begin with some background. On the 15th of November 2012, Melanie, the mother, received the call no parent wants to receive. Matthew has been found hanging and it's not looking good, was the quote. It came to light that Matthew had already been dead over an hour when that call was made. Melanie tells me this was the first, as she described it, lie of many more she was going to uncover after his death. I'm going to share a background into Matthew's short life, how he ended up under the care of the Essex mental health system, what went wrong, and the journey to any form of truth or accountability Matthew's mother has been on since his death in 2012, and her continued fight for truth, justice, accountability and change for others. And honourable members, I have to say that I've received a letter from the Honourable Member Robert Holford in support of this case. He too has had somebody in similar circumstances die in the same place. This is quite a long account, but this is understandable as Melanie's fight has been 8 years to date and has encompassed many trials to get to this point. And I have a statement from Melanie that she would have liked to have been able to read to you herself, but obviously that's not allowed in this place, and so I will read it out for her. In Melanie's own words, she says, "I write these words not just to represent my son, but to represent the multitude of lives that have been affected by the inadequate care offered by mental health services across our nation." Mr. Stringer, I almost within the last 10 minutes received a statement from families asking for it to be read out. I haven't got time to do that, but I would ask the Minister to accept it if I forwarded that message to her. Thank you. I am mum to Matthew James Leahy, born December 1991. He was a beautiful soul. He understood compassion and he cared for others. He was generous, he was kind, he was smart, he was funny, and in his younger years he wanted to be a comedian. He was quite shy in large groups and was a loyal friend. He was never one to encourage a fight, but he would stand up for himself and the ones he loved, and I'm proud to say my son was honest, not a liar, not like some I've come across on this journey. He loved the outdoors, loved anything water sports related, and was a fantastic skier. Having left grammar school, where he excelled in mathematics and computer science, he set up his own computer business, travelling between clients on his motorbike, and was doing really well. He had a natural talent for swimming. He actually saved 2 ladies from drowning, and when 18 he became a qualified lifeguard. Aged 19, Matthew was having trouble sleeping and complaining of pains in his stomach, and having stomach cramps, he was also hallucinating. When Matthew became poorly, we turned to so-called professionals for help. To help us understand what was happening with our son, he was sectioned for care and treatment. This sectioning and the failings in care at that time, although noted briefly in the inquest verdicts, have never been investigated. After Matthew's death, medical records show that the first psychiatrist involved in his care picked up a B12 and folate deficiency and possibly celiac disease combined with a thyroid issue. However, these discoveries were never addressed as a new psychiatrist took over Matthew's care and put him straight onto antipsychotic medication. Any further physical checks were minimal. On the 7th of November 2012, Matthew was placed under Section 3 of the Mental Health Act and admitted to the Linden Centre in Chelmsford in Essex. By the 15th of November, some 7 days in the care of the state, my son was dead. The last days of his life in a place he called hell, and I now believe it truly was a hell on earth. Alone, malnourished, over-medicated, scared, bleeding, bruised, reportedly raped, injected multiple times, ignored and frightened. No records of any staff in those last 7 days of his life offering him any comfort. I have been advised not to visit and to give him time to settle on the ward. I will live with the guilt for the rest of my life that I listened to the so-called professionals and I was not there when my son needed me the most. An inquest into my son's death was held in January 2015 and an open narrative verdict was reached which concluded that my son, quote, Matthew James Leahy, was subject to a series of multiple failings and missed opportunities over a prolonged period of time by those entrusted with his care. The jury found that relevant policies and procedures were not adhered to, impacting on Matthew's overall care and well-being leading up to his death. How the inquest concluded, I will never know. Staff were not interviewed by police after Matthew's death. An internal investigation was carried out, which the Parliamentary and Health Service Ombudsman has deemed flawed and not fit for purpose. This flawed investigation formed the basis of every investigation actioned after Matthew's death. The ligature was destroyed, the defibrillator was destroyed, door logs were not downloaded, and CCTV was hidden for over 7+ years and parts of it not retained or was deleted. So many more issues exist. I've not been able to determine or control any of this. Investigations, reviews, reports, etc. All processes that have happened around me, with me, but entitled to some, being entitled to some information and some explanation, but little voice, little influence and little power. I did think that the system would be open and honest, would explain what went wrong, hold to account those responsible for any failings, and afford justice for failing my most precious son. However, I have discovered a deeply troubling mismatch between what I expected and what I found. In any other walk of life, if there had been failings, heads would roll. This has never happened, despite criminal offences being proved. If the tragedy of losing Matthew hasn't been bad enough, to not know the full circumstances that led to his death whilst in the care of the state is unforgivable. I still do not have full disclosure and have never seen internal statements. Duty of candour went out of the window the moment Matthew died. It came to light after Matthew's died that paperwork had been falsified, backdated and slipped into his files. It took me 4+ years to finally persuade Essex Police to register this falsification of mental health documents as a crime. I thought, at last, they are listening to me. Then the bomb dropped. We won't be prosecuting as it's not in the public interest. The Trust has failed to take steps to protect patients in their care. The question remains why no individual has been held to account and why some staff involved in failing my son and other patients have actually been promoted to high-ranking positions within the NHS. The coroner called for a public inquiry after the inquest in 2015. There's also been multiple calls from various MPs in the last 5 years. The Parliamentary and Health Service Ombudsman went on national television after the Missed Opportunities report was published to say that if he had the power to, he would call a public inquiry. In October, last year, the Public Administration and Constitutional Affairs Committee held an evidence session on the Ombudsman report into the failed care of Matthew and also Ben Morris. Ben died in the same Linden Centre in 2008, aged 20 years. During the session, the Minister for Public Safety, Mental Health and Suicide Prevention explained, quote, that public inquiries do not happen for individual cases. In this case, a public inquiry is not an appropriate response because we are talking about two cases. I have now been joined in the fight calling for a statutory public inquiry into Essex mental health services by multiple bereaved and failed families, 55 families and growing. How multiple deaths can have gone on unchallenged for so many years and so many people in official positions not involved with this scandal have entrapped themselves by collaboration the moment they came across it. It has baffled me. How the system did not prevent these deaths or at the very least detect the failings, changes needed earlier, I'm sure is a question in many failed families' minds, not just mine. Where is the government's anger? Its thirst for truth and justice, its commitment to getting answers and ensuring it never happens again. Many families are losing loved ones while under the care of state mental health system, whether that be due to mental illness, additional vulnerabilities such as autistic and or learning disabled individuals, those misdiagnosed or dementia. It does not discriminate. The government is now officially, in her words, on notice of gross and systematic neglect, resulting in multiple avoidable deaths, and physical, sexual and emotional abuse and exploitation of the vulnerable, most of them young, historical and sadly ongoing. The right people in government need to understand the full extent of the Essex Trust failures. I have every faith that once the government commits to a full statutory public inquiry into Essex mental health, the fundamental truth of what and still is going wrong will be revealed. Through that knowledge, I hope justice and accountability are afforded and that necessary change is made for others who, like I and many others did, look to services when they need safe, compassionate care for their loved ones. I have to echo that point in respect of some horrendous cases in the Tees Valley, my own patch, Mr Stringer, but I will conclude with the following words. I offered the government Matthew's sad death to be a catalyst of learning and change months ago. Please call a statutory public inquiry into Essex mental health services without further delay. Make the changes in Essex and send the learning across the country. I hope that I can start to grieve the loss of my son, and Matthew will be able to then rest in peace. Thank you, Mr Stringer. I know that I've kept it narrow, but I felt it appropriate to reflect the true voice of the petitioners in this, and I thank you for allowing me to do that.
The question is that this House has considered E-petition 255823 relating to deaths in mental health care. A number of people on the list to speak. I will start with a time limit of 4 minutes. James Cartledge.
Thank you, Mr Stringer. It's a great pleasure to serve under your chairmanship and to follow the honourable gentleman in moving the debate for the Petition Committee. He spoke of the case of Matthew Leahy. It is a terrible, terrible tragedy, and I pay huge tribute to his mother, who has campaigned for years through the pain, which is without limit, and we all sympathise, I'm sure. But as the honourable gentleman said, I'm afraid the case of Leahy is not the only one at the Linden Centre, Chelmsford. There have been several others, all tragic, including my constituent, Richard Wade, sir. I held an adjournment debate on the case of Richard Wade in October. And at the start of that debate, because the HSE case was live, a much stricter sub judice ruling was given, which meant there were things I couldn't say in that adjournment debate, which I feel able to say today, but I have a very short period of time. So the key point really in the case of Richard Wade, and I don't have time to go through the details of the case, is that on the day he was found hanging in the Linden Centre in Chelmsford, there is strong evidence that his parents have seen, not just documentary evidence, but other evidence that has come to them, including from people who've worked at the Linden Centre, that when his body, still alive, was first discovered hanging, the clinicians who found it either panicked or for some other inexplicable reason left it hanging, locked the door, and allowed some minutes to pass before he was discovered a second time, this time with his parents nearby, and at that point he was given resuscitation and urgent medical treatment. And we do not know what the impact is on his eventual fate several days later when he passed away of those crucial minutes. So essentially, his is a life which I believe could have been saved, a death that could have been avoided. And I won't repeat all the points I made about Richard Wade's case in my adjournment, other than to say what I found so extraordinary about it is that he died in May 2015. In fact, I met him going to vote in Great Cornard in May 2015, a few days before I had the great privilege of being elected for the first time, and he found he was dead several days later. But the thing that was extraordinary was that in February 2015, another man, I believe called Beecroft, also died by ligature in the Linden Centre, Chelmsford, in the very same bathroom where Richard Wade hanged himself in May. And the extraordinary thing is, when the Trust reported on Richard Wade's death in December that year, they never mentioned the fact that there had been a hanging in the same bathroom 3 months earlier, as if you would think that's a common occurrence or something. It's quite extraordinary. And when the CQC came to investigate, because of course by April 2015 they'd taken over from HSE, I'm afraid they did not handle the case well. They did not investigate it initially because, in the words of the report they issued to the Wades in July, the inspectors effectively did not realise they had taken over the statutory responsibility from HSE. So it is a catalogue of failures, and the Wade case alone would merit an independent inquiry on its own. But you have Beecroft, you have Leahy, you have Morris, and potentially other cases. And so at the end of my adjournment debate, my honourable friend, who was being covered for at the time because I was speaking to the Minister, was isolating, announced an independent review into deaths at Linden Centre. I was very grateful for that because I know she has taken huge interest in it, and very sincerely so. And I hope that that can be a full, robust, independent inquiry, like we had last week into the Dixon case, which can uncover the truth, which can go into places that other mechanisms cannot. And I'll give way to my honourable friend.
These are terribly tragic cases and sometimes cannot be avoided, of course, but at times it is because of the performance of the Trust, perhaps of the management of that Trust. Where that is the case, does he agree that the leadership of those organisations must be held to account for their performance?
Well, my honourable friend makes an excellent point, and he's, of course, echoing the concluding remark from the honourable member for Hartlepool. And he's absolutely right. There has to be accountability. But I do think when we go into an independent inquiry, there's a danger of saying, well, it must be a statutory public inquiry, and getting into the real semantics of the mechanism that we use. I think what my constituents, the Wades, want is the truth. They simply want to know the truth about what happened to their son. And I think that we now have a very tangible offer from the Department of Health, a mechanism that we can all use, all the families can use, to get involved, to shape the terms of reference, and to help us to deliver something in the wider public interest, as again the petitioners seek, to the benefit of the whole country in terms of wider mental health, but above all, to bring some sense of accountability to all of the families who've suffered so tragically at the Linden Centre, Chelmsford, including my constituents, the Wades, including the Leahys, and I believe that the Minister will now act, and I give her all of my support in doing so.
Barbara Keeley.
Thank you, Mr Stringer. It's a pleasure to speak in this debate with you in the Chair, and I want to thank the Petitions Committee for granting this important debate, to thank my honourable friend the member for Hartlepool for opening the debate, and to congratulate Melanie Leahy on the strength of her campaigning to get us to this debate. As we have heard, Matthew's case is a tragic one with a catalogue of failures which culminated in his death. I know that nobody here can fail to be moved by what Matthew and his family went through, and the honourable member who's just spoken opposite certainly did so. Melanie has been fighting for answers and justice for her son for 8 years now, and I pay tribute to the work she has done. But I also say it should not have been necessary. Matthew was only in the Linden Centre for a few days. In that time, he reported a sexual assault to the police, but they took no follow-up action on his report. Staff claimed he lacked mental capacity despite no assessment being carried out. He was heavily medicated with both antipsychotics and tranquilizers. This heavy medication happened despite Matthew telling them that he would attempt to kill himself if he was given injections. And as we've heard, only a week after being admitted, Matthew was found hanging in his room and he died. This catalogue of failures would be shocking in itself, but it ended with a young man dying. In cases such as Matthew's, we have a duty to learn the lessons and ensure that others in mental health care do not end dying preventable deaths. Yes,
Jim Shannon?
Giving way and sympathise with her greatly and the story that she's telling and others have told as well. Does she agree that when it comes to helping people who have mental issues and psychiatric issues and who need help more than anyone else, that the facilities are so important to be modern? They need the inpatient care, they need the staff to be trained and able to respond. And does she feel that if those things are improved, that would be a step in the right direction to try and help people to prevent these tragedies happening?
Barbara Keeley?
Thank the Honourable Member. I think there's so much that needs to change, but he's right, that's one aspect of it. The mental health of state, of course, is very known for being run down and out of date. What I wanted to go on to say was that we've seen this has not happened in the Linden Centre. We haven't had learning of lessons and in mental health services in Essex. The charity Inquest has worked on over 28 cases involving deaths in mental health settings in Essex since 2013. Yet despite many investigations, reports and inquests highlighting failures, preventable deaths have continued. At the Linden Centre, Inquest is aware of 6 inpatients found hanging between 2004 and 2019. And despite repeated inspections and visits by the Care Quality Commission, people have continued to die in these services. Now, the Ombudsman report found clear signs of a cover-up at the Linden Centre. As Melanie told me, Matthew had no key worker. Records of the observation levels and when he had been observed were changed. His care plan was falsified after he died. His claims of rape were ignored. Lots of documents were missing and a whole catalogue of policy failings were uncovered. This speaks of a culture which was less interested in learning from their failings to one which was primarily concerned with avoiding blame for Matthew's death. The only way to restore trust in our mental health services is to publicly demonstrate that all those issues, including the one that the Honourable Gentleman has just mentioned, are considered and addressed. Melanie Leahy has suggested the only way to do this is through a full public inquiry. Now, at the inquest into Matthew's death, the coroner asked the NHS Trust to consider commissioning an independent inquiry into Matthew's death. The Ombudsman, in his recommendation, said, the review, due to be held by NHS Improvement, should consider whether the broader evidence it sees suggests that a public inquiry is necessary. In an interview on ITV, the Ombudsman went further on the failings, including Matthew's care plan being altered after he died and his claim of rape not being investigated. He said they were a catalogue of failings which are entirely unacceptable. He also said in the interview that he would fully support a public inquiry if one was recommended and would like to have investigated further himself had he had the powers. So both public officials who have investigated Matthew's death, the coroner and the Ombudsman, have said they would support a public inquiry. I ask the Minister, on behalf of Melanie Leahy, to set up a public inquiry. Only a public inquiry will have the transparency and broad participation needed to rebuild trust in the services. The Minister will know it is the only way witnesses can be compelled to give evidence without seeking to apportion blame, and evidence must be given on oath. As Melanie has said, since Matthew's death, I have been on a mission to get to the truth of what happened to him and to get justice. On my journey, I have not only found that many other families are in the same position as me, but also individuals who have survived the, quotes, care that they received. So in this most tragic case, inadequate and neglectful care led to the death of a young man like Matthew, and his mother's had to take on a fight over many years to get to the truth. I want to thank all the families and parents like Melanie Leahy who put so much of themselves into those campaigns. And I want to end by returning to what Melanie said to me. To say the current situation is not good enough is a massive understatement. We know what has to change, and we have known for decades. What will make the government take real action? How many times do we need to hear the same information and recommendations? How many more Matthews have to die?
Philip Hollowburn?
Mr Stringer, it's a pleasure to serve under your chairmanship. Could I congratulate the Honourable Member for Hartlepool for the wonderful way in which he opened this debate, and congratulate the two preceding speakers for their powerful contributions. I'm rising today, Mr Stringer, to speak on behalf of my constituent, Mrs Marion Coles, who was alerted to this debate and who contacted me about the subject. And I really want my speech simply to be what she has written to me, so I can place her concerns on the record. And Mrs Marion Coles says, I'm writing regarding the Westminster Hall debate concerning deaths in mental health care, which calls for independent investigations into deaths in mental health settings. As a family that has been personally affected by this after our son took his own life whilst a mental health inpatient in Kettering in May 2017, we would ask if you would represent us at this debate. This was the second suicide at this setting 7 months apart. Staff failings were admitted at the inquest and 3 nurses were disciplined, but they refused to give us the details. It has taken us 3 years for the NHS to settle this case. We were involved with the serious incident report that took place, but strongly support an independent inquiry being held after such deaths, as is allowed in other organisations. Why should an organisation investigate itself over a death that may have been caused or contributed to by failures of its own staff or systems? The lack of an independent inquiry hampers the ability to root out issues of system neglect or misconduct, and also jeopardises the welfare of future patients by failing to address such concerns. There is overwhelming evidence that the current system for investigating deaths in mental health settings is not fit for purpose. We very much hope that you will be able to take part in the debate and offer your support, which I do, for an independent inquiry for families that may be affected by these tragedies. I am deeply traumatised by the death of my son, as is all of my family, and we have to live with this every day of our lives. Mr Stringer, it's a privilege for me as the local MP to place Mrs Marion Coles' concerns on the record.
Janet Davey.
Thank you, Mr Stringer, and it's a pleasure to serve under your chairmanship. The circumstance of this debate is truly heartbreaking, and I would like to begin by extending my condolences to the family of the late Matthew Leahy, and to the families of all who have lost their loved ones with mental illness at the hands of those who are supposed to protect them and care for them. For many decades, mental health has not received enough attention or the funding in comparison with physical illness. And I would like to draw attention to the mental health unit in Lewisham. The mental health unit in Lewisham has already been viewed as not being fit for purpose. It was never built for people that have mental health problems. But yet the funding has never materialised to be able to make the changes that are needed to make it suitable for people that have mental health problems. Combined with the pressures of this pandemic, medical professionals are reporting more and more that people are suffering with mental illness due to economic hardship or loneliness. It is clear that there will be a greater demand for mental health services over the next few years, and it is imperative that we have well-functioning mental services that are well-funded to prevent needless deaths of the most vulnerable while they need to receive it. And the medical professionals and the police and everybody around them also need the support to be able to care for people with mental health illnesses. They need the training, the supervision, and most of all, not to be overworked and to be able to debrief when they themselves are finding things difficult. Today, I would like to raise the concerns of my own constituent of Lewisham East, the late Kevin Clark, who sadly died following a mental health relapse. My condolences go out to his family, who are still bereaving the loss of Kevin. And despite not posing an immediate threat to anyone, he was handcuffed and placed in a leg restraint, all while telling the police that he could not breathe. In October of this year, An inquest concluded that the officer restraint and the supervision towards Kevin were excessive and sadly contributed to his death. However, the police were not the only professionals involved in his care. Other professionals were also in contact with him prior to this tragic incident. A strategy of care needs to be in place for all mental health patients. One, where they are communicating and listening to patients. Also, where family members are involved, where loved ones can talk about preventative measures, talk about their concerns, and contribute to the care plans that are needed. Mental health doctors, mental health nurses, social workers, and care staff all need to work collaboratively with all professionals involved in keeping the most vulnerable people safe and secure, and to prevent these fatal, awful incidents of suicide, or whether it be other types of restraints leading to death. Mr. Stringer, change needs to happen.
Thank you. Honourable members have either not turned up or have taken less time than I expected. So unusually I'm going to increase the time limit for the last speakers to 5 minutes. Catherine West.
Thank you, Mr. Stringer, and it's a pleasure to serve under your chairmanship, and in particular to have the extra few minutes, because it allows me to speak about a constituency case. I wanted, first of all, just to put on record how moving the speech was by the member for Hartlepool, and also how many wonderful speeches there have been today, and to give this desperate situation the attention that it deserves. I also want to declare my interest as a patron of Mind in Haringey, and also to put on record my thanks to Deborah Coles, who is the Chief Executive of Inquest, who wrote this important briefing paper, and who represents now, sadly, hundreds of families who are faced with a similar case to Melanie Leahy, who are desperate, who they want to know the reasons, they want to know what happened prior to losing their child. And I do hope that at the end of this we'll have a positive statement from the Minister about a proper inquiry and recommendations to be followed as a result of it. The Minister may well remember Senny's Law, which was introduced by the member for Croydon North as a result of his campaigning and Senny's family, because he also died as a result of police restraint due to his having a very serious mental health problem, but not getting the correct care under the mental health services. And indeed, this Friday, I have a constituency meeting with a further constituent who has tragically lost her son in very similar circumstances. So this is not an isolated incident, and it's wonderful to be having this debate. I also wanted briefly to focus on some of the findings from Inquest and some of the other experts who have looked carefully at the similarities in these sorts of cases. So what we know is that failings between 2013 and 2016, that there were 71 deaths similar to the one that we're talking about today, and that despite a number of recommendations following each one of these, the coroner has recommended actions to prevent further deaths. And as the member said, for your seat, South Suffolk said, in very similar circumstances, the lessons simply are not being learned. And a question that I have, Mr. Stringer, is, are we doing a read across from conditions similar in the prison service, where I think the deaths have come down and that the lessons have been learned to some degree? So I wonder if there's some shared learning across different services. We know that in November 2020, where Inquest, the voluntary sector organisation which helps families, reported that they looked into 20 recent cases of deaths in adult inpatient mental health settings and found the same issues repeated: lack of staff training, poor record keeping, failing to involve the family in the care of the patient, a lack of local specialist units and staff shortages. And we know that as a result of COVID, as other members have mentioned in this speech, we have an opportunity now to do things differently. We know that we can do much better in terms of accessible data on the number of deaths and how people have died. We know that we could do much better in terms of training our mental health professionals. And at CQC level, we could do much better in terms of inspections so that this appalling area is cleaned up once and for all. We know also that families at crucial times, there's a failure of communication, so that for months and months the family are just left not knowing what is the next step, what is going to happen as a result. And that's why it is crucial that, as we've all said here today, that we have the correct level of oversight at national level to monitor the learning and implementation, but also crucially that we have that statutory public inquiry. It can be into Essex, but what matters is that whatever it is, that it's generalised across every single mental health setting, and in particular that in the context of COVID, where we know that there's going to be at least 20% more people suffering from mental health conditions and more younger people who are disproportionately affected by COVID, that there's a real urgency to this work, and I do hope that we as members can put more pressure on health and social care to really tackle this problem once and for all. Thank you very much, Mr. Stringer.
Kim Johnson.
Thank you, Mr. Springer, and it's a privilege to serve under your chairmanship today. Matthew Leahy had his whole life ahead of him. He was just 20 years old when he was detained in November 2012 under the Mental Health Act and transported to the Linden Centre, a secure mental health unit in Chelmsford. 3 days after his admission to what his mother, Melanie, believed was a place of safety, Matthew reported he had been drugged and raped, and 4 days later he was found hanged in his room. Multiple inquests and inquiries over the ensuing years into the conditions surrounding Matthew's death have uncovered evidence of serious care failings, including the fact that Matthew's paperwork was incomplete or missing, and no key worker had been assigned to him. It was revealed that Matthew had no key plan and that staff had actually falsified one after his death and backdated it. I welcome this petition and this discussion and would like to take the opportunity to pay tribute to Matthew's parents and all those who have campaigned so hard to get truth, justice and accountability. I also welcome the announcement by the Minister of Health last month to launch an independent review into serious questions raised by a series of tragic and potentially unavoidable deaths of patients at the Linden Centre between 2008 and 2015. And it's absolutely right that we commit to uncovering the truth about the significant failings in the care and treatment of vulnerable patients, and that the mantra of learning lessons is not merely a soundbite accompanied by endless, toothless reviews, but actually results in substantive and tangible change. And no mother should ever have to go through the dreadful loss and devastation faced by Melanie Leahy, and so many others who made difficult decisions in impossible circumstances to hand their children over to the care of others where they believed they would be safe. And no family should have to campaign for years to forcibly expose the negligence and the incompetence of a system that contributed to the death of their loved ones. And we know that many black people are overrepresented in mental health services and disproportionately subject to the use of taser on wards, and this needs to stop. And I congratulate Mary Seacoe House, a mental health charity in my constituency, for the work that they have done over many years in supporting patients with mental health and for shining light on these type of injustices. So my question to the Minister today is, how can we challenge and improve the process and culture of attaining such inquiries so that families bereaved by state neglect and wrongdoing are integrated at the very heart of conversations about accountability and change, and not blocked, bullied, stigmatised or cast aside with accusations of being a nuisance or a problem in their quest for truth and justice? Thank you, Mr. Springer.
Peter Gibson.
Thank you, Mr. Stringer. It is a pleasure to serve under your chairmanship, and I congratulate my Tees Valley colleague on opening this debate today. I join with all honourable colleagues for all that they have said so far and echo their expression of their sympathies and prayers for the family of Matthew Leahy, and I pay tribute to Mrs Leahy for her efforts. Sadly, we are all too aware that Matthew's case is not alone. The death of a child is something that no parent should have to experience. I know from my own family circumstances that the impact for the parent is lifelong lasting, and through several close family connections, I know that the anguish that a parent whose child is lost to suicide is even more painful. In 2019, 195 people died whilst in mental health care across the UK, with one of those deaths occurring in my constituency at West Park Hospital in May 2019. This sad death, and indeed all these tragic deaths, serve to tell us that we need to do more. As politicians, we must always be looking to do more to support the mental health care sector, to improve outcomes and to avoid deaths. And we must do all we can to support the staff in our mental health care sector too. Every one of these tragic deaths will have had a profound impact on the staff in these facilities too. In 2018-19, the government increased spending on mental health to a record £12.5 billion, and the NHS long-term plan for mental health increases spending each year by a further £2.3 billion. But we all know it's not just about the cash. It's about the leadership, it's about the management, it's about the culture, and it's about the care. I welcomed the recent CQC report Out of Sight, which acknowledges the shortcomings of some of our mental health facilities, the challenges they face with patients, particularly those who suffer with autism, and the sense that these places designed for care are not therapeutic. I hope that this report's recommendations are followed through, which will in turn address some of the shortcomings, and it is hoped we'll see less deaths. Listening to the Honourable Member for Hartlepool, I firmly believe it is vital to embed a culture of learning, safety and improvement across the mental health care sector. And I look forward to hearing the steps the Minister and her department are taking to tackle this issue, embedding a better culture throughout the sector and do all it can to prevent all deaths in mental health care. The Minister will have heard the calls for independent investigations and inquiries, and I add my voice to those calls.
Does the Honourable Member for Strangford wish to speak?
Thank you very much.
Jim Shannon?
We're starting to but thank you very much, Mr. Secretary. I first of all thank all of those who have set the scene, and we thank them for that, and the Backbench Committee for also what they did. I think it would be unreal of us all not to have our hearts go out to all of those who have MPs and honourable members who have spoken on behalf of their constituents, and to thank them for that. And I admire the determination that each and every one has shown, that the breakdown in care that took place does not see another family in that situation. Mental health has been an issue, and I want to take a slightly different tangent if I can, Mr. Stringer, and that's to do with how we can help within the system, and ultimately that's what the Minister would do in a response. I see too many of my constituents broken and in need of support who've been let down by the system. I can remember one young man, Michael, who came into my office in the age, and one of the girls in the office, a young fellow who was homeless, distraught, and my girls were able to reach out and tell him in a very helpful way, a compassionate way, your life is important, and we will help you. And he broke down in tears, but we managed, we were able to help that young fella, get him accommodation. The housing executive were the ones that helped that. Also give him some help from the local food bank, who are always there to help. We were then able to get him sorted out with his benefits. And what happened to that young fellow was he just disappeared off the grid. He clearly had mental health issues and wasn't able to cope. Now, he got the psychological help he needed, and he got the benefits, and he got his benefits renewed as well. So the pressure for him became less of a difficulty because of those who helped. And that was the housing executive, the benefits office, the food bank, the local churches, and all those people who came together. So it's my sincere belief that Michael, if he hadn't come to the office, and I believe this in my heart, Mr. Stringer, that would have been a young fella who would have been maybe not have survived, and we all believe that in the office, from the girls and those we spoke to. Everybody, every government body was exceptionally helpful, and we thank them for it. So the Foundation for Mental Health. Ours is not to question how or why they've got to the stage that they find them in. It's only to see how we can help them where they are. It's about the overhaul of the facilities that I spoke to in the intervention to the Honourable Lady. It's about the facilities being updated. It's about the inpatient help in those facilities that it makes it helpful or hopeful for people to reach out. And those who are desperate to see an upgrade in the facilities that are sometimes not even fit for purpose, the fact that there's no privacy. And sometimes people need to have a bit of privacy where they are, but they also need to be able to reach out and have someone to help them in the time that they can. Some of the wards that I'm aware of would be mixed gender, where obviously no privacy is even more of a problem. And then when it comes to people who are allowed to visit 1 hour each once a week, I don't feel that's enough. I think there should be more time allocated for that. And I'm always very aware of the great work that the occupational therapists do, Mr. Stringer. They have a brilliant team with fantastic ideas. They allocated some rooms for activities. I think it's important to have some sort of organised activities so that those who are under pressure psychologically and mentally and socially where they are can have somewhere to look out. And one of the things that the OTs come up with back in the area that I represent has been the issue of a garden, a therapy garden, things that happen and can be done in-house and done in a way that can really help. The gardening classes, again, designate that area for them and make sure that they have it. And it's little wonder, and I conclude with this, Mr. Stringer, that patients remain, and those who are in homes remain uninspired and unhopeful. This is how they view a place designed to provide the help and support they are crying out for. It is clear that we must make massive changes, and if the first step to this is an inquiry, then that is where we must begin. My heart goes out to all the families and other families who grieve and feel let down. Mr. Stringer, we can do better, I believe, and not only that, I think we should do better and must do better. Thank you.
Andy Carter.
Thank you, Mr. Stringer. It's a pleasure to contribute to this important debate under your chairmanship. Can I start by paying tribute to the Honourable Member for Hartlepool? I thought he opened the debate incredibly well. And I'd also like to pay tribute to Matthew Leahy's mother for her campaigning to raise this issue here in Parliament. I'm incredibly grateful to the 185 people in Warrington South who've signed this petition, many of which have also been in touch with my office to raise their concerns on the issue of deaths in mental health care over the last few days. There is, Mr. Chairman, an unsatisfactory gap in the ability of regulators to enforce sanctions in serious cases, in particular those which involve death or serious harm to individuals, where catastrophic deficiencies in standards of care are involved. Aware of this debate over the weekend, I heard from Richard Evans, who lives in Appleton in my constituency, and whose daughter Hannah tragically took her own life 5 years ago. At the time of her death, Hannah was a detained patient on the Sheraton ward at Hollings Park Hospital in Warrington. Hannah was a 22-year-old young lady and had spent a short amount of time in a number of different settings as a detained patient, and had also been cared for in the community by her own family. Despite awarenesses that Hannah was a complex patient with an extensive history of tying life-threatening ligatures and an intense fear of change, she was given just 2.5 hours' notice of her transfer that day to a different hospital by those who were caring for her. When the decision was discussed with her parents, they didn't object. Critically, though, they didn't know that Hannah had been involved in 9 ligature attempts whilst on an intensive care unit. Had they been aware of the history, they are under no doubt that they would have attempted to block this movement to protect and care for their daughter. A fundamental lack of communication between ward staff, management, and the family, the next of kin, led to a decision which ultimately resulted in the tragic loss of life of Hannah. The inquest into Hannah's case highlights a series of failings at this ward, but also a national problem regarding the lack of provisions in place to properly support vulnerable young adults diagnosed with personality disorders, and more widely, for the significant number of people in this country who suffer from mental health conditions. Now, I welcome plans to establish a new health service safety investigations body, a new executive non-departmental public body, but it must have the powers to conduct investigations into incidents that occur during the provision of services and have strong implications for the safety of patients. Critically, this body must also improve the quality and effectiveness of local investigations by developing standards and providing advice, guidance and training to organisations. But I'm keen to see stronger steps taken with prosecutions, holding those who lead care settings to account. The Care Quality Commission currently has relatively limited powers to prosecute, which has in part been formed by reservations about the value of criminal enforcement in healthcare. Now, legalities aside, speaking to Richard Evans, Hannah's father, the key issue with many of these sad cases seems to be a basic lack of communication, firstly between local NHS trusts and services, and then a dialogue with families when deaths sadly occur, something that can and must be addressed. It's so important that we take a zero suicide policy to prevent unnecessary harm on individuals and their families in the future, and lessons need to be learnt from the past. It's time to review the legislation to improve care in what should be a place of safety for those who are at their most vulnerable. Thank you.
Kevin Holloway.
Thank you, Mr Stringer. It's a pleasure to speak on your chairmanship. And can I pay tribute to all the speakers today who've spoken very movingly, particularly the honourable gentleman for Hartlepool, but I guess even more particularly Mrs Leahy, who sounds like an incredible person. And I guess all that she is dedicating her life to now is trying to make sure lessons are learned and changes are made, but also individuals responsible for mismanagement or maladministration are held to account. And the case I want to allude to very briefly is one that the Minister is familiar with. One of my constituents, Richard Bellaby, who's under the care of the Sheffield Health and Social Care Trust. So these issues are not just pertaining to places like the Linden Centre, which sounds horrendous, but he presented himself there. He was somebody who had a history of suicide attempts. Presented himself there one evening. He was referred there by his GP. He was seen by untrained nurses who used a triage tool, an assessment tool, which was designed by Sheffield Trust. These nurses were not trained to use it. They rated him through use of that tool as presenting no risk of suicide. He was then released back into the community, and very sadly that evening took his own life. And Mr and Mrs Bellaby, his parents, have championed the cause of trying to find truth and justice, and have been prevented at every turn by Sheffield Trust. The communications have been terrible. It's been denial after denial, lie after lie, which eventually had to come to an inquest to prove that Bellaby's were right, that Richard Bellaby's suicide was preventable. All that Mr and Mrs Bellaby wanted was an apology, admission of failure of their mismanagement. Instead, it was denial, obfuscation, and it cost £100,000 probably in that order in legal costs, much of which, of course, to the taxpayer, when the actual compensation bill at the end of it was only £9,000. So, and incredibly, through all that time, even after it was demonstrated that Mr and Mrs Bellaby were right, that their son had been poorly treated by the Trust, no compassion, no remorse, no proper apology. It's simply unthinkable. And that was back in 2015. The CQC had given quite a damning rating of the Trust back then in 2016, but they did another assessment in 2019. The most recent one showed there were 47 breaches of its legal requirements, that Trust. Inadequate, rated as inadequate, now in special measures. And one of the things that runs the report is this a constant reference to a lack of training. So what had been learnt in that 4-year period, instead of the Health Trust holding its hands up and saying, yes, we got this wrong, yes, we're going to put it right, which is what the Bellabys wanted in the first place, and I'm sure what Mrs Leahy wants, but instead they just were in total denial. And of course, the issue that Mr and Mrs Bellaby want to make sure is assessment tools are prohibited, not used within the health service. They've stopped being used in the Sheffield Trust, I'm pleased to say, but there's 32 other trusts that apparently may be still using them. And I know the Minister's been great with his family, has met them personally with myself, and is championing the cause of trying to improve best practice in this area. But there are questions still remain of whether those lessons have been learned in other trusts around the country. But key to this, as honourable members have alluded to in their speeches that I've heard today, is has the leadership of this trust and other trusts been held to account for their maladministration? Kevin Taylor was the CEO at the time and the accountable officer. He's now left, a new chief executive taken over. I would really like to know whether he left with a payment and without any blemish on his track record, or whether he's been held to account, or there's been sacked for his underperformance. Because demonstrably, for years, there's been an underperformance of the leadership of that trust. And unless we start making sure that individuals who run these trusts are held to account if they get things wrong, and many do a fine job, of course, unless we start holding these people to account, these tragic cases will continue to happen. Thank you.
Yeah.
Dr. Rosina Allen-Khan.
Thank you, Mr Stringer, and it is indeed a real pleasure to serve under your chairmanship and an honour to respond on behalf of the opposition in this profoundly moving and powerful debate. And I really would like to thank the Honourable Member for Hartlepool on securing today's debate, but I think it goes without saying that every single contribution that's been made today has been extremely powerful, and in everyone that has made a statement today and made a contribution, they have indeed stood up for their constituents and really very well represented the issues and made their points so clearly and concisely, and done Melanie Leahy and the other families of which they spoke very, very proud. We're here today because of a mother's love for her son and her desire to receive some answers into his tragic and untimely death. It is fitting, then, that this debate takes place ahead of National Grief Awareness Week. Matthew Leahy was just 20 years old when he was admitted to the Linden Centre in November 2012, after having been detained under the Mental Health Act. Whilst in the care of North Essex Partnership University Trust at the Linden Centre, Matthew phoned his parents on numerous occasions to express his unhappiness at being detained there. I know I am speaking again of some of the things which have already been mentioned, but I think it's important that we put on record the details as many times as possible in order to get this across as powerfully as needs to be to see the change that we want to see. 2 days after being admitted, Matthew phoned his father to tell him that he had been drugged and raped on the ward. Following a 999 call made by Matthew, the Linden Centre staff gave assurances to the family that he was indeed safe in their care. Just days later, Matthew was found unresponsive and hanged in his room. He was transferred to Broomfield Hospital, where he was pronounced dead. Matthew was in the Linden Centre for just 7 days. As a mother myself, I cannot comprehend what Melanie has had to contend with over the last 8 years. Sadly for Melanie and their family, their struggle is not over. An inquest concluded with an open narrative verdict that Matthew was subject to multiple failings and missed opportunities over a prolonged period of time by those entrusted with his care. Multiple investigations and reviews carried out into the North Essex Partnership University NHS Foundation Trust and into Matthew's care raised even more questions about the care Matthew received and the nature of his death. I want to raise some of the concerns that were found in these various reviews so everyone here can further understand the scale of the challenge Melanie and her family have faced for the past 8 years. At post-mortem, traces of the drug GHB were found in Matthew's system. He had bruises just above both ankles and 4 to 5 unexplained needle wounds in his groin. Matthew's paperwork was incomplete and a key worker was not assigned to him. Staff at the Linden Centre had not issued Matthew with a care plan, but after his death, they falsified one and backdated it. A number of ligature points in the Linden Centre, previously identified for removal, were still there.
Essex Police dropped a corporate manslaughter investigation into the deaths of 25 patients who were in the care of the North Essex Partnership Trust at 9 separate establishments since 2000. The Ombudsman investigated and agreed that Matthew had not been responded to appropriately after reporting a rape. They also found that the Essex Partnership's investigation into Matthew's death was inadequate. All this in 8 years. The toll it has taken on this family. This is before we consider the prosecution of the Essex Partnership University NHS Trust by the Health and Safety Executive following the deaths of 11 patients in their care between 2004 and 2015. The multiple lives lost and families torn apart is just devastating and most tragically, utterly preventable. We have to learn from these tragic losses so no other families are affected. So I ask the Minister, will you please work with Melanie Leahy on this matter directly, as your predecessor promised to do? I've had the honour of speaking to Melanie ahead of this debate. This is her day. This is Matthew's day, and a day for all those still seeking answers into their loved ones' deaths. The strength it takes to continue this fight after 8 long years is commendable. My heart goes out to her family and all those who have lost loved ones in similar circumstances, not just at the Linden Centre, but in care settings across the country where they were meant to be safe. Many of them were mentioned today in this debate, and I thank the members for their contributions again. A system is not working properly if it takes so long to investigate such a tragedy, and yet answers still aren't forthcoming. A grieving mother should not have to plead with people to sign a petition to get answers surrounding her son's death. There should be no barriers to the truth. Inquiries and investigations should not be reserved for the most privileged and those most familiar with the system. On this point about time, I'd like to highlight that it's taken over a year to have this debate following Melanie's successful petition. We all understand the mitigating factors that this year has brought about, but I would like everyone to consider how every step of this process has been slow and that barriers have been put in place for the family at every single turn. I'd be delighted.
Would you agree with me that
James
being
Cartledge?
so, it would be very much in the interest of all stakeholders if the inquiry that's going to come forward was to take place ideally as soon as possible?
Dr. Rosina Allen-Khan.
Thank the honourable member for his contribution, and yes, of course, it would be in everyone's best interest for it to take place as soon as possible. Thank you. After all this time, Melanie deserves some answers. I support her call for a statutory public inquiry into Essex mental health services and for an independent chair to be appointed. It is crucial that lessons are learned from Matthew's case. I'd like to take this moment to read a few words from Melanie about why a statutory public inquiry is so important to her. To come this far and then get fobbed off with a review or general inquiry would simply take us all back to square one. She goes on to ask that the Minister do something real and meaningful that paves the way for truth, justice, accountability and change. There is an opportunity here for the Minister to commit to provide a grieving mother with answers into her son's death and commit to learning lessons so other families do not suffer in this way. We cannot and we must not delay any further. Thank you.
Just before I call the Minister, we have plenty of time, but if she can leave enough time for the wind up at the end. Thank you. Minister.
Thank you, Mr Stringer, and it is a pleasure to serve once again under your chairmanship. And I would like to begin by congratulating the Honourable Member for Hartlepool on securing such an important debate on the e-petition calling for a full public inquiry into the tragic circumstances surrounding the deaths of Matthew Leahy and the wider issue of deaths in mental health inpatient settings. I'd also like to thank all the Honourable Members present today for making such valuable and powerful speeches on what is such an important issue. I would just like to say, Mr Stringer, before I start, that I am going to make quite an important announcement, and therefore, if anybody feels the need to intervene, if they could wait until I've finished, so that there is no ambiguity on behalf of the relatives who may be listening, and that they fully understand what it is that I am saying and the reasons why I am saying it. I think in this particular case that is quite important, particularly for Mrs Leahy and the relatives. Matthew Leahy took his own life while he was in the care of the NHS. His death was avoidable, as were the deaths of a number of others, of the people in the same facility, and while nothing I or any of us can say today can ease the pain of their families and friends, I am determined that we learn the lessons from these tragic events.
Barbara Keeley.
I'd just like to raise a question with the Minister. She said that Matthew took his own life. Melanie Leahy doesn't accept that. I think it would be easier if we use the formal words, he was found hanging, and the inquest was an open verdict. So I don't think it's appropriate in this debate to say that he took his own life.
Minister.
Until we have proceeded a little bit further, there are a form of words that I have to use at the moment, and they are the form of words. There is no contention about how Matthew died or how he was, or the appalling circumstances within which he was found. Absolutely no contention on that, but I have to use a particular form of words at this point. As I said, nothing can ease the pain of Melanie or other relatives of others who were found in similar circumstances in the Linden Centre. Matthew died in November 2012 while he was in the Linden Centre, a mental health facility in the former North Essex Partnership University NHS Foundation Trust. I understand the devastating impact that this has had on Matthew's family, and especially Melanie, who I've spoken to twice, and my heartfelt condolences, as they did when I spoke to them, and they do now, and will continue to do so, to go out to them. The petition we are debating today calls for a public inquiry into the death of Matthew Leahy on the grounds that past investigations have been inadequate. I first met with Melanie last year, and I was deeply moved by her story. And I took that story away and have continued to work since I first spoke to Melanie. I have since met her again and some of the other families whose loved ones have died at the Linden Centre, and my thoughts are equally also with them. As a result of what I have heard, both from Melanie and other relatives, today I can confirm that there will be an independent inquiry into the events at the Linden Centre, covering the period from 2000 to the present day, as requested in Mrs Leahy's petition. This will ensure that all of the tragic events are given the attention they deserve to ensure the lessons are learnt. The scope will not go earlier than 2000 or after 2020 in order to keep this inquiry focused and report in a timely manner. I consider that 20 years is a more than adequate time frame to enable us to understand what has happened at the Linden Centre and to learn from it. I'm in the process of appointing a chair, an independent chair, and I'm considering half a dozen leading candidates at present. They will need to be robustly independent and command the confidence of the families. I've chosen the route of an independent inquiry rather than a public statutory inquiry so that we can move quickly. It will be able to call witnesses and undertake a close examination of what actually happened to patients who died at the Trust to inform its findings. And I will also, can I just continue to the end of the statement? And I will also appoint a barrister, a QC, to assist the chair in their investigations, along with a full secretariat. It will be independent and will consult families on the specific terms of reference. As an independent inquiry, it can determine how it wishes to work with the families so that they are able to give their accounts. I will not pull any punches. Honourable members will be aware of the report of the inquiry into the life and death of baby Elizabeth Dixon published last week, which set out the details behind what it described as a 20-year cover-up. I can cite too the Morecambe Bay investigation and the Patterson inquiry. Independent inquiries commissioned by my department which left no stone unturned and were frank in their criticisms. I expect witnesses to come forward irrespective of the type of inquiry. Public inquiries can compel witnesses to appear. However, and this is an important point, although public inquiries can compel witnesses to appear and give evidence under oath, they do not have to give evidence which would incriminate them. However, they do not, and it is incumbent upon all holders of public office and health professionals to demonstrate their fitness by voluntarily cooperating with independent inquiries that seek to protect, I will when I finish the statement, that seek to protect future patients and offer closure to families. The Patterson inquiry, and this is a very important point, the Patterson inquiry referred 2 doctors who refused to give evidence at the independent Patterson inquiry to the GMC, who are being investigated by the GMC, who refused to give evidence. So it is not the case that if someone in a professional capacity refuses to give evidence at an independent inquiry, that they are not held accountable, as in the case which is patently demonstrated by the doctors being investigated by the GMC now. That is just not the case. I was hoping originally, in the original time frames that we set, that the inquiry might report within 18 months. But as I have today extended the scope from 2000 to 2020, covering a 20-year span, it will take longer. But I am hoping that the inquiry will find within 2 years. I hope to announce the chair and outline the terms of reference in a written ministerial part. I will. Okay. Go ahead.
Barbara Keeley.
I think it'd be easy if she'd just let me ask the questions. I think it's important. I mean, I think it's been clear, and it was clear from what my honourable friend said, that Melanie Leahy isn't necessarily happy with an independent inquiry. I think we should be clear about that. So there is the question of compelling witnesses to attend, but I think that she's talking about appointing the chair. I think it's important that for complete independence that any inquiry has the support of families like Matthew's. Can the Minister tell us, will she consider making a position improved, the position of chair approved by an independent body, or for instance the Health Select Committee? I don't think people are going to be comfortable with the Minister herself appointing the chair. There's been too much, and other members have referred to it, of, somebody appointing somebody and then, you review me and I review you. So I think that is a really important point.
I'd like to get this inquiry going, and as in all other inquiries that have happened in the past, I think and I believe it is the case, and I will come back to the Honourable Lady on the reasons why, that ministerial responsibility has to be taken. And therefore, and I do want to get this inquiry underway, and as I was just going to say, before Christmas. So I'd like to make a written ministerial statement to the House before the Christmas recess, setting out both the terms of reference of the inquiry and naming the chair, with the provision that the inquiry will commence the second week in February.
Barbara Keeley.
I think the points have been made here that Melanie Leahy has campaigned on this for 8 years and done a wonderful job on campaigning. And I get the reasons for trying to do this quickly, but I think really to move ahead and appoint a chair unless the Minister's clear that the families and particularly Melanie Leahy is happy with that, I just think that would be too much haste. I think the chair does have to be seen to be independent, and I'm not sure that I'm particularly happy with how she's outlining it.
Mr. Stringer, we will go through the processes that we have been through within the Department of Health, which are set in law and which are abided by during every inquiry, including the Dixon inquiry, the Patterson inquiry, the Morecambe Bay inquiry. All inquiries in the past, the same protocols will be adhered to and the same process. But
If I may say, I'm incredibly grateful for what she's just said. I know that she has had to battle to get this through, and it's because she sincerely believes in the cause and bringing justice. But in my view, it's important that this happens quickly, as I said earlier in my intervention. And my worry about a statutory inquiry is it would take months and months to set up. as my constituents, the Wades, I think a key thing for them is time, but actually it doesn't matter what the semantics are as long as what we do finds the truth and probes further. And isn't it the case that with Dixon, that's exactly what they did?
Minister.
My honourable friend's absolutely right. There was no stone unturned in the Dixon inquiry. I mean, it took 20 years to conclude, and the summary was devastating in terms of what happened. A nurse can no longer practice in this country, and the cover-up that took place over 20 years by trust, doctors, medical staff over that period of time took 20 years of probing, but it happened. And the fact that there's some kind of, a public inquiry is going to find out more. One of the advantages, actually, of an independent inquiry is that it can work much closer with the families and take into account the considerations of the family, talk to the families, involve them, whereas that would not happen with a public inquiry. And I believe that an independent inquiry, as has been demonstrated in each one that's being conducted, with it, the relationship that's been built with the families, the information, the way the families have been able to input into an independent inquiry, is actually important in this case, that the family stories are actually heard, because some of the stories are complex, they're painful, they're detailed, and rather than taking a view of the entire trust, and also I'd just like to say that extending the inquiry from 2000 to 2020, as I've done this morning, actually incorporates both trusts, both the former trust and the existing trust, because we do have a situation that occurred recently within the new trust. So we're able to incorporate both trusts and everybody, and actually even more families.
Catherine West.
It's very generous giving way, and inquests certainly say they think a statutory inquiry would be best. However, could I ask, over a 20-year period, for those of us who have had constituents email whose children are now in social care, for example, one with 11 different hospitals, first went in when she was 14, she's still there, she's 22, at a cost of £700,000 per annum. What learning is there sort of at an interim level? Will this inquiry allow for learning as we go, rather than waiting 5 years for the report? Because in that 5 years, we could lose another 10, 15 patients each year. So what's the interim sort of milestones that could give support?
My friend's absolutely right, and we would hope for an interim report, but it would depend on the chair, because once we've appointed a chair and a secretariat and the ability to appoint a QC as required for interviewing witnesses, then we have, as a department, as ministers, as MPs, we have absolutely independent means independent. Nobody can have any influence on that inquiry. But we would ask for an interim report, particularly if there were findings. But we do have to be aware that also findings may prejudice or not prejudice something that may come as a result of the inquiry. So, but yet learning is absolutely the key. That's why we've established HSIP. And also, I think this is an important point at which we can mention medical examiners. In April 2019, we appointed medical examiners into hospitals. Today, if there is the death of a patient, a medical examiner examines the death certificate, looks into the circumstances of the death. In fact, my honourable friend will know this herself from being a practising doctor. Will look into the circumstances of the death and will liaise with bereaved families. So the circumstances which surrounded the deaths, we would hope would be improved already by the medical examiner system, and that incorporates learning too. But absolutely the point of this inquiry is to, it's been some considerable time since there has been any kind of inquiry into a mental health setting. And so it's important that we do this so that we can have that 20-year window and we can take those examples, look at that report and take away the learning. And if that can be introduced in an interim report that we can take away, that would be excellent. But I can't guarantee that because we don't know what a chair or the Secretariat are going to find once the inquiry begins. And actually, I didn't finish before an intervention. I am hoping that the inquiry will commence the second week in February, but the Chair and the Secretariat will be appointed before December recess.
Would you set out, assuming this independent inquiry finds somebody responsible, culpable within the management, would you set out what sanctions might be available to her or to that inquiry to hold those people to account?
Minister.
Well, it's not my role as a minister to issue sanctions, but if there was anything even remotely untoward that the chair would discover during that inquiry, then it would be referred to the police. So it's an inquiry does not cover up criminal activity, and that is in any inquiry, not just this inquiry. So there would be accountability.
Barbara Keeley.
I just want to touch on inquest. Given the new evidence in Matthew's case and many others, I wonder if the Minister also thinks it would be appropriate to revisit some of the inquest verdicts where they returned open narratives, because I think that can be very important to the families.
Minister.
I cannot agree and I cannot comment, because inquests and coroners, as my friend knows, is under the jurisdiction of the MOJ. And so coroners are themselves almost in the vein of judges. And so it would be for the MOJ for that question to go to and to be answered. That's a legal jurisdiction and isn't within DHSC. Our job is to launch an inquiry, make sure there is a robust independent chair, make sure it is fully funded and staffed and ready to go as soon as possible, establishing terms of reference in consultation with the families, as many families as possible, as soon as possible, and for the inquiry to commence. As has been mentioned, as members will be aware, the Health and Safety Executive has investigated how the Trust managed environmental risks from fixed potential ligature points in inpatient wards between the 25th of October 2004 and 31st of March 2015. As a result of this investigation, the Health and Safety Executive has brought a prosecution against the Essex Partnership University NHS Foundation Trust, which was formed by the merger of the North Essex Partnership University NHS Foundation Trust with South Essex Partnership. I am sure the honourable members will understand I am unable to go into details of these proceedings as they are before the courts. I think it's probably there is quite a bit I could say about this particular petition and the cases, but what I think I'll conclude now and let the honourable member for Hartlepool have the final say. But I would just like to finish, I think, by thanking Melanie Leahy for her years of campaigning. I hope Melanie will understand that an independent inquiry, a robustly independent inquiry, which is unafraid to turn over stones and to work with the families and to call those it sees fit to give evidence, will understand that this is a way to discover what has happened at the Linden Centre over the past 20 years, what culture developed, what practices were in place, and what happened to those young boys who died there. That is what, as my honourable friend said, that is what is important, getting to the truth. It doesn't matter what the framework is or the structure. What is important is the truth, and knowing how those young boys died, what happened, and what we can learn from those dreadful mistakes.
Michael, to wind up.
Thank you, Chair. I'd just like to thank the Petitions Committee, the staff, for the hard work they've done in the background, for all members here who have conducted themselves with dignity and passion and representing the interests of their constituents in a fine way, and front bench, shadow front bench for their contribution, and of course the Minister. I can't say whether Melanie would be happy with that, but she clearly has called for a statutory inquiry, but I would prefer that the motion be put. Chair, thank you.
Thank you. The question is that this House has considered E-petition 255823 relating to deaths in mental health care. As many as are of that opinion say aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order. The sitting is suspended until 6 p.m. and please will members leave the room by the exit at the back there to ensure the safe arrival and departure of members. Thank you.